They say it's bad to clean your ears. Really? Not really. Judging by the available data, it is really not worth cleaning your ears with a cotton swab vacuum devices and candles. But if you maintain ear hygiene correctly, there will be no harm from this. What is earwax and why is it needed? The auditory canal connects the inner ear to the environment. Like other body surfaces, it is lined with a superficial layer of skin, the epithelium. The skin protects the body from dust, microbes, and viruses, so that the surface layer of cells eventually wears out and dies, and new cells come in their place. If we are talking about the skin of the face, hands, or feet, then dead cells simply crumble, but they have nowhere to go from the ear canal. Fortunately, in the course of evolution, people have an original way to get rid of dead cells in the ear canal. This is the production of earwax. In addition to epithelial cells, there are sebaceous and sulfur glands in the auditory canal. They secrete a secret that mainly consists of fatty acids and cholesterol. All this glues the dead skin cells into a single mass. People of European and African descent form a yellow viscous mass, which is called wet sulfur. People of Asian origin have light and dry sulfur. What kind of sulfur a person will have depends on genetic characteristics. The degree of humidity and the color of sulfur do not affect the health of the ears. When a person chews or talks, sulfur separates from the walls of the ear canal and gradually shifts to the outer part of the ear. So the body gets rid of garbage and at the same time moisturizes the ear canal and acquires additional protection from bacteria and fungi in an acidic environment, which provides sulfur most of the pathogens do not survive. What happens if you never clean the ear canal? Nothing terrible will happen to most healthy people because the ears are able to get rid of sulfur on their own schedule. To remove the sulfur that has left the ear canal, it is enough to wipe the ear canal. It is enough to wipe the auricle with a soft, wet cloth or towel. However, every 10th child, every 20th adult, and every 3rd elderly person has sulfur plugs in the auditory passages. As a result, dizziness, discomfort, pain, itching, or ringing in the ears may occur, and some people have hearing problems. There are many reasons why sulfur plugs can form. In some people, sulfur accumulates due to the ear canal being too narrow by nature, excessive production of some components of earwax, infection, or dermatological diseases. At the same time, one of the main reasons that leads to the formation of traffic jams is improper ear cleaning. Why is it harmful to clean your ears with a cotton swab? Although it seems that cotton swabs clean the ears, in fact they push most of the sulfur deeper and seal it. Because of this, in some people, sulfur in the ears is compressed into dense lumps that cannot come out of the ear naturally, and plugs are formed. Cotton swabs provoke the appearance of sulfur plugs, statement of the American Academy of Otolaryngology. Plugs can form not only because of cotton swabs, but also because of other tools designed to clean the ears. That is, ear curettes and spiral tampons can also contribute to the formation of sulfur plugs. Plugs are not the only problem that can occur when cleaning the ears with long and hard devices. Using these devices, it is easy to scratch the ear canal. Germs can get into the ear through a scratch. And you can also damage the eardrum. In this case, a person risks losing his hearing. It is also not worth using ear candles, one end of which must be inserted into the ear and the other should be set on fire. In fact, such candles do not remove earwax, but they can injure or burn the ear. How to clean your ears safely. If you can hear well and do not feel any discomfort in your ears, it is better not to clean them. But if the plug is still formed, you can try to remove it yourself. You will need a means to soften the cork and a rubber pier that will help to wash it. Here's how to proceed. Put 2 or 3 drops of baby oil, glycerin, or a 3% solution of hydrogen peroxide in your ear. This will help to soften the cork. Usually you need to wait a day or 2 for this. Rinse the ear with warm water from a rubber pair. Do not insert the nose of the pear into the ear canal. Just gently pour a little water there as from a watering can. Then tilt your head over the sink and gently pull the earlobe towards the chin, so it will be easier for the water with sulfur to flow out. Dry the outer ear with a towel or napkin. If it was not possible to wash the cork the first time, the procedure should be repeated several times. But if this did not help and the plug remained in place, it is safer to contact an otolaryngologist. The doctor will be able to remove it without harming the ears.